Your years of experience teaches you how to place implants. Guided surgery shows you how to rightly place implant in the bone. But why you should trust me and my words? I'm Sudeep Paul and I'm associated with guided implant surgery since last 18 years. And I say we should not rely on surgical guide. It's a complete validated treatment system. More than 75,000 plus cases. I got the opportunity to be there with the practices, and 5,000 plus practices have been trained globally in guided implantology. Why traditional implant system has risk? We say there are few thumb rules are there to validate the treatment systems, understanding the bone quality, achieving vertical dimensions of occlusions, defining occlusal tables of all the implants. So in the bone, we manage all the implant planning as per the prosthesis, to define all the occlusal table so that we can achieve not only to place implants, we can achieve the exact height of the multi-unit abutment, soft tissue gap, and the prosthesis from the incisal edge to the head of the implants. We can create gap so that you can deliver right prosthesis, not only the implant. And we say what people mostly misunderstood about the guided systems. We only trust about surgical guide. We say surgical guide is just acrylic tools. You should not trust it. Behind the guided surgery, as it is said, it's a blindless procedure maybe. It is not. We evaluate bone density, bone quality, primary stability, success of the osseointegrations, all these things in the guided surgery. There's a validated treatment systems. We achieve all the systems of the treatment plan, all the principles of the treatment plan, maybe full arch cases with all-on-4, non-all-on-4, regular implants, parallel implant, all these things. And evaluating all the bones, anatomical structure, then only we incorporate standard procedures of the implant placement as per the prosthesis. And there is something, it is called step-by-step breakdown of the entire process, right from the data acquisitions to the surgery. So what is it? So diagnosis of the treatment plan, then implant standards of incorporating the treatment plan, like what standards of the implant placement. Maybe it is all-on-4, all-on-6, parallel implant, bilateral implant. Then incorporating one workflow, sequential surgery, non-sequential surgery. Then making the decisions about the surgery, how the surgery would be. Mouth opening limitations, maybe sequential guide, maybe flap or flapless surgery. Let's say there is one treatment planning case. I'll take you through the walkthrough of the entire treatment plan. What workflow has been incorporated. Okay, this is a single implant case and we are planning for a 1/6 side. You can see the tooth is missing there in this side. So how we can utilize the guided implant surgery is that we say that first we need to define the ROI, that means region of interest, where you are going to position the implant first. So it's a reverse engineering process. So we first define the tooth, and then as per the tooth, we validate the emergence profile of the abutment, that means abutment axis. So we know how to position this implant. Traditionally, of course, with the freehand can be achieved, but in the guided implant surgery that is said, there are 4 rules of implant validation, that means side validations, bone validations, proximity check, and emergence profile. That means we want the implant not only in the bone, we want the implant rightly in the bone. So we can see this is the cross-sectional view where we are positioning this wider platform implant, that we know this is the nerve proximity is there in the nerve. We can maintain 3 mm proximity, and with the 10 mm implant, we can position the implant in the side with this. At the same time, we can evaluate how much bone in the surrounding of the implants we can keep there, and subcrystal implant position. So the stop of the implant will be maybe 2 mm subcrystal implant placements we are doing. So all this information just before placing the implant, we do all the maths there in the guided surgery planning. So call is that side validations and positioning the implant rightly in the bone, right? It is not about placing the implant in the bone. And final validations, we cross-check what is the proximity between both the implant, at the same time, the emergence profile of the abutment. Once we are happy with this treatment plan, we prepare the surgical guide, single implant, tooth supported surgical guide, so that we can prepare the osteotomy exactly as per the treatment plan, and we can restore the tooth. So this is involved with the validated treatment planning with the guided surgery. If your treatment planning is not right, of course, no guided surgery can help or no surgical guide can help. So we spend time in placing the implant, not only in the bone, we spend time placing the implant, rightly positioning in the bone, at the same time expecting the right emergence profile. And then only this guided surgery will work. So this is why we call it the validated treatment planning system. Look, what I have shared today, if it resonates with you, I'm actually going to teach you in person in GCOI conference on 13th of March, where I'm going to incorporate all this workflow so that you should not trust and depends on only surgical guides. This is basically a global conference of oral implantology that is happening in Guwahati, and I'm going to share right from the implant planning to surgical guide design how you can validate all these things for your routine implant practice. The hands-on part, after this program, you will get 6 STL export for your patients so that you can immediately after this workshop, you can apply this patient's license for your next 6 cases. Registration details are there in the descriptions if you are interested, and I would love to have you there. It's always better to learn this stuff in hands-on rather exploring all these things all alone. Thanks for watching.